Okay, so Dr. Blair is the Chief Exec of Integrated Magnetic Systems, 15 years experience in the pharma industry, and was the International Director of GSK, and so the inventor of the magnetic protein applications. It's raised in excess of 10 million and been through 2 AIM IPOs in 2004 and 5. Dr. Eddie Blair.
Thank you, Nathan, and thanks Neil and Claire for an excellent introduction to Farmer Ills. I could talk for another half hour on stratified medicine's companion diagnostics, but I don't want to do that. I'm going to talk about targeted magnetic proteins. This is a little company we've formed along the way. It's been going for a few years now, and I'll describe a few things. I'll talk about the commercial potential of the markets we want to go into. Talk a little bit about our team, because like Claire just said, it's important to surround yourself with good people. Give you some of the latest data and talk a little bit about our forward plan. So the technology, this really arises out of a program I ran for ITI, Scottish Enterprise. And with a provider, Access Shield, and a lady, Prabs Dihal, involved. And she recognised that microfluidics used antibodies and magnetism to shift things around, but actually the current solutions weren't really very desirable. To magnetise antibodies last century, what you'd do is purchase antibodies, you'd purchase magnetic beads, you'd pre-activate the beads and conjugate the antibodies and maybe have some luck getting antibodies in the right orientation. Some cases they did what you wanted them to do. I can use my shadow finger to point here and here, whereas other orientations weren't so good. So we came up with a genetic engineering approach, and that is to take the business end of an antibody as a genetic fragment and stick it onto a metal binding protein. And when you express that, you end up with a bifunctional protein. One end binds metal, one end binds the target of interest. And then, because we're using ferritin, what you end up with is an all-biological nanoparticle. So ferritin's natural role is to sequester iron, and then it displays on the surface the fusion tag. And the process we developed is to go from the iron that's produced in the endogenous expression system and replace it with magnetic iron. And for those of you keen to know what single-chain antibodies look like, you take the business end of an antibody, the genetic clone has the target determining regions plus spacer regions, and then you use a linker to combine the two specific binding fragments of an antibody. In terms of iron and ferritin, iron's naturally insoluble. And so transport around the body is usually by proteins that will bind and sequester iron, such as lactoferrin, transferrin, etc. These proteins bind a few ions of atoms, 10 to a dozen. However, ferritin is very interesting, and it encapsulates 3,000 ions of iron. And you end up with these biological nanoparticles you can see here. This is from a recent publication. This is our own data. And what we've done is we've digitized this information and looked at the mean diameter of these things. So they come out around about 20 nanometers with a relatively narrow spread, given the limitations of digitization. So this is ferritin. And now, so when you combine the two, the single chain antibody made up of these two binding regions, a metal binding domain, what you end up then with ferritin is 12 molecules displayed on the surface of this biological nanoparticle. This is what we imagined it looks like. This is some of our EMs showing the diameter is about 20 nanometers. Dense iron core, proteinaceous surface. And then quite interesting, we've been wondering, how do we show this number to be true? And actually, Gary Nabel just put a paper out in Nature a couple of weeks back where he's put on fluorohemagglutinin onto the surface of ferritin, and you can actually see, yes, there's 12 molecules stuck on there. So we actually think we've got some evidence now that we're actually forming this reproducible entity. The reason I was asking Nathan about patents before is that we were quite careful about the IP we gathered in and how we managed that. We've licensed 2 pieces of IP, one from Scottish Enterprise, and this is from the the ITI program I mentioned earlier, and that is for what's called targeted magnetic fusion proteins. That's granted in the EU and in Russia. It's on the US patent highway, and behind that there's 3 additional patents filed on uses of these targeted magnetic proteins. We also recognise that there was some dominant IP using ferritin as a fusion partner, and indeed that's what was in the publication from Gary Nabel. And so we've actually licensed from a company called New Century Pharmaceuticals a patent that's granted in the US and has been through the Canadian system. With that IP combined, then with third-party opinion that we've got clear freedom to operate. So this IP is licensed on a global and exclusive basis. So again, it qualifies for patent box when we start to make sales. Let's see. So the markets. Within separation, there's a market for reagents we think is worth about 40 million, and we can address 5 million of that at annual peak sales. Diagnostics, point of care, particularly on the molecular side, is a 400 million market. Again, we can target some of that. When we start to go in vivo, we think there's an opportunity for our proteins for imaging. That's a huge market and a huge opportunity for us. And of course, given my background in therapeutics, I'd really like to see us get into biological therapy, and particularly thermal ablation. That's an enormous market, $40 billion in total, and we can address 320 million of that. At the moment, we're pushing through in bioseparation, but starting to work and raise funding for the IVD opportunity. And of course, within those areas, there's key players that we're looking to as key partners. And that's why I was asking Claire over coffee how she sold her company, because we'd really like some of these company buys pretty quick. Okay, microscale separation. There's revenue streams within this market. One is to work with companies like Bio-Rad in their new microfluidics-enabled platforms. We're looking at a number of adapter proteins, and this was the basis of our first business plan. These are proteins that are magnetized directly, but rather than have antibodies or targeting entities on them, they'll bind biotin or they'll bind antibodies because they get protein A and streptavidin as part of them. Then another thing we're looking at is, can we start to generate magnetic antibody libraries? So go out like an Abcam or a Santa Cruz, but instead of selling antibodies for research, we sell something that's much more useful, and that's got a magnetic tag on it. Within IVD, again, there's 3 revenue streams we're looking at. The pre-analytical bit, the bit that gets your analyte from blood or from urine or some other biological sample into a format where it can be analysed, is pre-analytics. And we think we've got some tools that we can develop that would help the pre-analytical companies like QIAGEN, etc. We know there's a number of diagnostic companies out doing immunoassays as their key activity, and we'd like to make bespoke antibodies for those companies. So for a company like Diasorin, we make a vitamin D magnetic antibody, etc. And then an exciting piece that we've developed and enhanced a little bit over the recent months is the detection opportunity. And that's combining magnetics with a way of detecting the presence of that analyte. And I'll talk a bit more about that. History. Jamie Love, who's here, and I founded the company in the first half of 2009. Jamie, bless him, negotiated with SE for almost a year to get a license out of them to do the work that we're now doing. Once we'd agreed that license, we were able to raise some seed funds, my own investment and others, to set up labs and offices along the riverside in the technology park in the second half of 2010. We got a number of grants and seed funds, and actually the grants, again, it's down to Jamie. We've had smart feasibility from SE, we've had smart R&D grants, we've received Technology Strategy Board biomedical catalyst grants. And indeed, if you follow Twitter or you're on Twitter, follow me, because I'm tweeting a lot about trying to get the biomedical catalyst grant refilled for the coming year. It's almost run out of money, and there's a lobby to push more money through there. the TSB biomedical catalyst has made a big difference to SMEs in the UK. Being in Dundee with the regional selective awards, with a number of business-specific awards, and we've used innovation vouchers from a number of organisations in the area too. All this funding, as I say, brought in by Jamie, has contributed about £500,000 to our business. On top of that, we've brought in £1 million in equity funding, 2 tranches. The first tranche was July 2011, second tranche July last year, and we're now seeking the last round of angel funding of £500,000 to get us through to full commercial potential of the technology. We're doing some work that really makes it attractive to partners. And we're looking for that funding based on a pre-money valuation based on the funding to date. Okay, the company, right. Chairman is David Evans. He'll be known to many people in Dundee, particularly as having brought Axis and Shield together to form Axis Shield Diagnostics, which was until last year Britain's largest independent diagnostic company. It's now part of the Alere Group. David is also has been chair with BBI in Immunodiagnostic Systems, where he and I work together. He's done numerous IPOs, raised hundreds of millions of pounds, and he's currently chair of a number of our companies. So he's a very important guy to go out and help us with fundraising. And like Claire says, a good advisor to have around. My background, as Nathan said, ex-GSK with Ken Duncan a few years back. When we had dark hair and weren't grey or thin and top, we had a few good years at GSK, I think. I'm on the non-exec, I'm on the board at Diagnostics, a number of our companies, raised money for Finova, an Oxford-based biotech in 2005. And because it opens a gateway to lots of young, eager advisors and students, I'm a visiting scholar at Cambridge University. So that keeps me busy. The key lady to this invention is Prabs Dihal, who's here. Prabs actually is the true inventor of the technology. I had some ideas after she came up with the big idea. So she is really the core inventor. As I say, she conducted the invention in proof of concept when she was at Axis Shield. She's a molecular immunologist, spent lots of time at Dundee, but also at the Patterson Institute, a key cancer centre in Manchester. All of our people, the ones in yellow, are here, so please do talk to them. We've not signed up for the biopartnering. I know we've had some requests. Please talk to Prabs or Jamie, they're here. So is Laura, one of our lab team, and Lois, our very able PhD student. And then we've got lots of our people supporting the business geographically to help with business development. So that's all of our people. It's not quite 110 yet, it's not quite 200, but we will get there. The portfolio looks like this. So now this is the things that we're making that we think people want, and we're told people want. The first single chain antibody was really a proof of concept. It binds fibronectin, and we've done lots of proof of concept work with that. Another antibody that again is partly proof of concept is one that Lois has been working on. It binds nitrophenol, a non-natural ligand, and that's been very useful for setting up some of the specificity work that we want to do. Then I mentioned these adapter proteins as the core of our bioseparations business. We've made one that's a biotin binder, which we think has applications in molecular diagnostics as well as traditional IVD. And just recently we've successfully made and partially characterised a protein A ferritin fusion, which binds antibodies extremely well in a pattern that you'd expect of these things. We're developing a number of other antibody ferritins, some that bind DNA, some that bind tumour antigens. We're looking at a third adapter protein, one that binds bacterial DNA and really helps with antibacterial pre-analytics. And we're looking at variations of ferritin to create greater stability. And the last thing that's quite interesting is that we're looking to acquire a phage display library, because that will allow us to make single chain antibody ferritin fusions very, very quickly against defined and often novel targets. And for all this information, we've been working with a number of universities, St Andrews, Dundee, Edinburgh and Glasgow, to acquire this information about what's the affinity of binding, what's the magnetic moment, and what's the selectivity of binding. And our academic partners have been first rate in helping us with this work. Advantages, it's a human ferritin, so we think it's less immunogenic, potentially less toxic, and we've got some data that supports that. The size is very important. If you're going into microfluidics and nanofluidics, then the 20 nanometers is key to that. Probs has developed some processes for loading different levels of iron, so you can tune the magnetization of these proteins. And that, of course, opens up doors for multiplexing. There's a consistent valency. We believe this data from Nabel shows that it's 12 per molecule. They're relatively inexpensive to produce when you compare it to buying beads, buying antibodies, conjugating them, and throwing half your antibody away. We know it's scalable. We can do a reasonable scale production. And of course, if we start to look at in vivo work, it's biodegradable. Some of the work we've done with St Andrews, this is using superconducting quantum interference, a very sensitive magnetometer, tells us a key thing, that our magnetic proteins are super paramagnetic. What does that mean? Well, when you apply an external magnet, all the magnetic cores within the protein line up and give you an enhanced magnetic signal. When you remove that magnet, they turn back to an unorganized state, so the particles in the proteins themselves aren't magnetic without the applied magnets. That means they flow better in microfluidics and nanofluidics. So we think this is a key benefit of the way we put these proteins together. This is done with the guys at St Andrews. We can show that a strong magnet will attract the protein from a solution to that magnetic ring. You can see that here. That's over a period of 5 minutes. If you want to see it live, go to video. We've got some exciting music there, so you can see it's not spliced and dubbed or anything. So it's a little bit of fun there, but it moves relatively quickly in a macro scale as well. Effects in cell culture, minimal effects on toxicity. This is done at Dundee, so we think these proteins are quite safe. They are taken up and internalized. You can start to see them within cells in EM. We've got some binding data. This is work done with a number of collaborators, and in this case, we're showing that the affinity of our initial single chain antibody is actually pretty good, 6.5 times 10 to minus 10 molar. We're actually trying to conduct some studies to see if the display of 12 antibody molecules on the surface creates a cooperative binding effect. So we're actually quite excited to know if there's something more in here than just straightforward affinity, if there's avidity, as it were. Protein A ferritin, again, looking at subclasses, it binds human 1, G1, human G2, not G3. Doesn't bind goat IgG. This is the same pattern as you get with authentic protein A. So the material we're making as a fusion protein is robust and authentic. If you look at the binding, this is protein A, this is protein A ferritin fusion. Post-magnetization, it retains, as far as we can tell, full functionality. So we've got a magnetic protein that is able to bind selective IgGs. So we're quite excited about this as an adapter product. So what's the, I've talked a lot about technology, I've talked about various opportunities. What's the real opportunity? Well, as you heard from Neil, healthcare is changing. When a patient goes into a doctor's, the patient often knows a little bit more than a doctor about a condition, because you can get a lot of information. Some of it's not always right, but it's certainly available. And so the doctor here is really having to work out additional ways of providing that better diagnosis. And one of the things that's in the vanguard of this better diagnosis is what's called point-of-care diagnostics. This is where you're using a small footprint device, something that runs very fast. It's got to be within that 8 to 10 minutes of a GP visit. They've got to be low cost, because you're going to put them in doctor's surgeries. You can't charge them the size of a big lab analyzer. You need to go small. And of course, they need to be accurate in terms of guiding what's actually wrong with the patient. This is where our magnetic proteins really come into their own. They have the small size, features in the miniaturization. As I say, the super paramagnetism ensures they flow freely. That helps with fast, small-scale fluid manipulation. We think we can produce them at low cost and scale, and that, of course, fits in with the pricing structure in the NHS and elsewhere. And of course, the material is reproducible and helps with accuracy. So this for us is our key opportunity. This is where we want to take the company in the next step. So that's what the business plan says. It says this is how we do it. We've got various plans, how the money we raise, how we spend it, when we start to make sales. So this is something we try to sell to investors rather than just pitch at them. Point of care testing, we've taken a dip in doing this stuff by working with a Finnish company, Magnesense Technologies. They make this wonderful little handheld magnetometer. And the magnetometer is actually based on a very old technology, which is good old lateral flow. You put a sample onto your sample pad, it's drawn by an absorbent pad through a nitrocellulose wick, and then over a certain point, if your antigen is captured by an antibody here, and then it is captured by a bead that has a magnetic moment, then that's the signal you get coming out of this. So we've started to work with Magnesense, and particularly Natasha Sinskevich, and she's started to show that you can add our material at the bottom, and it wicks up and forms a very nice binding event over the striped antigen on these nitrocellulose strips. And then that can be read, and the reading is equivalent to industry standards Miltenyi beads and Estepore beads, both of which are substantially larger, but you can see we can still get a good magnetic signal on the Magnesense. So we're doing some of that work in collaboration with the guys in Dundee and Cardiff for BBI. As I mentioned, detection's taken a little bit of an upturn for us as well. And what we've been able to do is reproduce some literature observations that magnetize ferritin, but not unmagnetize ferritin. So the ferritin you might pull out of bacteria or have in nature. Pre-magnetization, there's no peroxidase activity. But once you've magnetized it and you add substrate and catalyst, you get a really very nice peroxidase activity. This is a chemical reaction dependent on the redox state of the magnetic ion within our proteins. And it gives us an opportunity for both magnetic readout and colorimetric readout. And we think that's very exciting. There's a potential here for better detection. Multiplexing, I won't bore this in any detail, but multiplexing we think can add different metal ions. We've only worked with iron, but of course we can do other things. We might even be able to add gold into there. If we use different magnetic protein tails, then of course we can create more or less magnetic proteins as well. And this then allows us to do multiplexing in more complex diagnostics. Okay, so what have I been through? I've described the technology for you, commercial output, our team, latest data, which really is very exciting, and a forward plan into in vitro diagnostics. So all that's left for me to say is I'm happy to take any questions. Thank you.